Welcome back to the Morning Blend. Did you know nearly 1 in every 3 adults over the age of 65 falls each year? And for seniors, most of them don't even report it to their healthcare providers. Prevention is key.
Absolutely. Joining us with more is HealthCare Partners clinical educator Aliberti. Hello, how are you?
Hi, good morning, everybody.
So let's talk about falling. Obviously, it's scary at any age. It seems like the senior population needs to be extra cautious about this. What are some things that they should be on the lookout for?
Well, that's a great question, and you're right. Everybody does have a tendency to fall, but with seniors, it's even more traumatic. Let's start at the beginning by talking about the fact that over 30% of community-dwelling elderly, those people that are living in the community, fall every year.
Wow.
And about 50% are unreported. So, I mean, we can see that it's quite a volume. Now, even though a lot of seniors are falling, most of them don't result in injury. So that's a good thing. But what happens with falling is once a senior falls, even if they don't get injured, they limit their activity so they don't fall again, which makes them weaker and puts them more at risk for fall, and thus they're falling again.
The cycle continues.
Yes, the fall cycle.
Are they embarrassed also because they don't want to report it, they don't want to tell people perhaps, or because they didn't get hurt and so they don't say anything?
Well, it's probably, some of both. You know, they're embarrassed about the fall and they're not hurt. But some of the things that seniors can do, or what you need to think about in terms of risk factors, are impaired cognition, something with your mind, vision, visual disturbances, particularly depth perception when you're taking a step downward, also medications. There is more of a risk if you're on 4 or more medications, and then also some of the arthritic or stroke limitations that occur after you have those conditions can also put you more at risk for fall.
So people, after they fall, they obviously want to cut down their risk of falling. Some people take the route of just not doing anything, much of anything. What can we do other than that, of course, to cut down on that risk?
That's a great question. I think one of the most important things is seniors need to stay physically active. And I'm not saying go to the gym, but even gardening, walking, anything like that to stay active, get muscle strength and bone strength. Also, in your home, there's a lot of safety things you can do. Love those throw rugs, but you need to throw them out.
That's why they're called throw rugs, yeah.
And those electrical cords, get them out of the pathways. You have to place, everybody's big on feng shui. We'll fix your furniture so it's not in your way in your walking path. And then also talk to your doctor about any problems with your medications that might make you more dizzy or more at a risk for fall.
So they can definitely talk to their doctor about it. You have programs, you can assist seniors.
That's correct. At HealthCare Partners, we do a very comprehensive assessment and evaluation with our seniors annually to make sure that if there are any other additional risk factors that we're addressing them early. And we have lots of programs like that. We have a total care model for our patients that looks at everything, including their home environment, medications, and their disease states, and see what we can do to prevent falls.
You do a great job with care, especially in the senior community, and this is like a big time for the senior community because open enrollment for Medicare is right now.
That's correct. Open enrollment is a time where seniors that have Medicare can go and learn about other choices and changes to the program. It's right now. It started October 15th, and it's going to go through December 7th. So I'm going to look out in the audience and say, all of you seniors out there, start looking and see what else you might learn about Medicare and what choices you have.
Because this decision will end up possibly affecting your pocketbook. You want to make sure you get the most bang for your Medicare pocket.
That's absolutely right. There's a lot of great programs out there for seniors, so make yourself available to them. Study them right now.
Yeah, this is the only time to make those changes every year. It happens once a year. So if you don't make those changes, then you are stuck with the plan that you have.
Right.
Basically, for the year.
Right. So open enrollment right now. Check it out and check out HealthCare Partners.
Where can seniors go if they want to learn more about the enrollment process and about the services that you provide?
Thank you. So HealthCare Partners has 300 primary care providers, 1,300 specialists, and on our website at www.keepyourdoctornv.com, you can find out a lot about what we're doing in terms of supporting open enrollment activities in Clark County.
And that's keepmydoctornv.com.
Keepmydoctornv.com.
Awesome.
Thank you so much.
It's a pleasure.
Thank you.
Thank you for joining us. joining us. Again, HealthCare Partners hosting 3 free open enrollment events early next month so seniors can learn more, one of which is on Friday. If you want, have any questions, rather, go to keepmydoctornv.com. You'll also find a list of upcoming events on that website as well. See the falling and recovery tips again on our website, vegasmorningblend.com.
Still